What we're going to do now is demonstrate what's called shoulder packing. I'm going to go to the other side of the table first so I can demonstrate what an unpacked shoulder is, and you can see it more clearly. As I raise Jonathan's arm like this and pull it upward, his whole shoulder blade and head of the humerus, the head of the arm bone, follows. That's an unpacked, unstable shoulder structure. Now, when a person has to reach really far in an unusual way, that's okay to do. But many people will perform this action on a regular basis and keep their shoulder unpacked often, if not always, as they do any movement to reach out with their upper body. So when a person is vacuuming, they'll be reaching out this way. Or if they're shoveling, they'll be pushing and pulling this way. Or if they're actually doing anything where they're doing dishes or reaching out to do things, they'll actually work it this way. Vacuuming is also very classic. Now I want you to roll your shoulder back and down and lock it in place. Keep your elbow straight so that as it's back and down, I can lift your body right up by your shoulder. So pull the shoulder back and down, lock it in place, and that's a packed shoulder. What's happening is the shoulder is packed back and down so that Jonathan can actually bend his elbow to do dishes, keep the shoulder packed, or vacuuming or shoveling or raking without bringing the head of the humerus away from the midline of the body and thereby causing micro tears over a period of time of the rotator cuff muscles. The rotator cuff muscles with a unpacked shoulder will begin rubbing over the bony structures in these areas and over time cause micro tears that can become a maximal tear once you end up having an injury or an accident or something which moves the body beyond its ability to cope in that way. Also, when a person has their shoulder unpacked all the time, it compresses the tendons in the front of the body as well as the brachial plexus, the nerves that run into the arm. So the individual can easily develop biceps tendonitis or some other kinds of concerns that they could have easily avoided. So again, rolling the shoulder back and down, packing the shoulder in, keeping the elbow straight so that I can lift the body up, the weight of the body with the shoulder packed, so keep it down, packed in, and that, again, is a packed, stable shoulder.